Okay. Okay. So may I start with in the name of God, most gracious and most merciful. We, AMIA NSW, welcome you all to this session. As you're aware, COVID is causing a lot of stress over the world and across the community everywhere, as well as in our community as well. So we thought to make it as an awareness program in the community so that it has been addressed properly and managed or dealt in a right way for the benefit of our community. Mental health is a very important part of our life, which can affect the relationship of the family or in between the colleagues, academic performances, job opportunities, and it can even cause death. We are fortunate to have 3 experts in this panel. That is Dr. Prashant Mayur, Dr. Sunida Job, and our facilitator, Manjur Abdullah. Let me thank Dr. Shahir and Ashim for getting the speakers on board. With these words, I also respect the traditional landowners whom we meet today. I pay respect to the elders of the past, present, and emerging. With these words, may I invite AMIA NSW Vice President Fibir Abdullah to have a few words.
Thanks, Alika. Assalamu alaikum, everyone. First of all, I'd like to welcome each one of you to this awareness session, what we are conducting today, and the expert panels of speakers, Dr. Prashant Mayur, Dr. Sunita Job, and Dr. Manjur, and all other coordinators and facilitators who from the AMIA community. I hope all of you are keeping safe from this pandemic. Good part is we are reaching the end of the tunnel, and hopefully we'll be back to normal soon. But I'm sure many of us have gone through a lot of stress in this past because of this pandemic. So I urge each one of you to actively participate in this session and clarify your queries with these experts. I also want to add a few points on this Friday Club activity. This is more like a monthly activity, what we do on every second Friday of a month. It's mainly catering to any informative session, any awareness session, or any other educational or it can be any other social activities. We are hoping that we can move to face by early next year. So that we can all meet and have some fun and have a dinner, like back to normal. Once again, I welcome you all to this session, and please do enjoy and clarify all your queries. Thank you.
Thank you, Fabi, for the kind words. Let me let you know there's be a Q&A session after the speakers, and that'll be managed by Dr. Shahir and Manjur Abdullah. Now, let me introduce you the facilitator, Dr. Manjur. He's been working as a senior registrar in psychiatry, currently working in St. John's of God. He has a vast majority experience in psychiatric field. He's been working has worked in India, UK, and in Australia now. He has attended a master's and diploma in psychiatry, and I think we cannot get a better person than him to facilitate this function. Over to you, Manjur.
Thank you very much for inviting me for this meeting. And yeah, I've not facilitated a meeting before, but still, as I'll try my best to do my part of the job. But anyway, I would like to first of all, I'd like to introduce the main panel speakers who will be the speakers for today's meeting. Um, so first, I would like to introduce Dr. Prashant Mayur, who has kindly accepted our invitation, and I thank him for his gracious presence in our meeting. He is a general adult psychiatrist with extensive experience in several fields of the psychiatry, including mood disorders, psychosis, ECT, and many other fields as well. He is considered one of the authority in ECT, and he has gained a PhD in the field as well. And he has several articles to his credit and hundreds of citations of those articles in various journals. He is a much appreciated and much recognized authority in the field of us ECT, and we are very grateful and honored to have him in our this meeting. And we thank you very much again and again for his presence and giving us his ideas and knowledge, sharing his knowledge with us. He has also developed a special interest in several fields, including ADHD, Asperger, intellectual disability, neuropsychiatric conditions, and also he is an expert in medico-legal questions as well. I would like to welcome him to our meeting once again, and thank you for his presence. Coming to the next speaker, I don't know, Dr. Mayu, he's my supervisor. He has been my colleague and supervisor in Cumberland, but with Dr. Sunita, I've not worked before, but what I understand is that she is a clinical psychologist who works with adults and families presenting with a wide range of difficulties. She holds a master's and PhD in clinical psychology and PhD thesis, and was in the area of anxiety disorders. She has extensive experience working in public sector organizations and hospitals in the assessment and treatment of clinical disorders. She also has been involved in training clinical psychology master students and is a board-approved supervisor. She has a keen interest in complex trauma, trauma-related presentations, domestic violence, and perinatal mood disorders. She is also trained in parent-infant psychotherapy, attachment issues, and parenting. Her other areas of interest include mood and stress-related disorders and women's mental health. We also very much appreciate Dr. Sunita's presence in this meeting, and thank you very much for accepting our invitation and sharing your knowledge and expertise with us. So that's briefly about the introduction of the speakers. So if we could move on to the next part of the thing, I would like to invite the speakers now to have a brief chat with us. Maybe if Dr. Prashant Mayur could give us a brief talk on the COVID and impact on mental health, please.
Okay. All right. I'm going to speak for about 15 minutes or less, and I'm going to keep my talk as informal and as straightforward as possible. Please feel free to ask me questions later. So I thought I was wondering when I spoke to Hashim initially as to what should I speak in terms of COVID-19 and its mental health impact. And initially, let me begin by thanking Hashim and your organization in inviting me for this brief talk. So I was just thinking about what to actually talk about, because COVID-19 has been a pandemic which has been there with us for about, let's say, 1 year, or 2 years actually, to 2019 towards the end, 2020, 2021, so 2 years. So the literature base in mental health, I was just looking at I was doing a basic data search, and there's literally hundreds of articles on mental health impact in COVID-19, but it is still in a very infantile kind of a very infancy kind of a stage. It's not really crystallized into anything solid. Maybe in the next few years you can start noticing much more of a mental health impact of this quite an extraordinary period of 2 years. I think in our lifetime, this is probably the single most significant worldwide traumatic event, by and large, compared to any other. It's almost like being in a war with an invisible enemy, and it's a once in a lifetime. Hopefully, it's a once in a lifetime thing for all of us. But it has produced a significant amount of mental health impact, and we are still. I'm not sure whether we still appreciate the full mental health impact of COVID-19. Maybe in the next 2 or 3 years, maybe 5 years, we'll really come to know what it's done to us in terms of mental health. From a clinician standpoint, working in the public system, in the private sector, and in my clinic, I don't see pure COVID-19 related psychiatric conditions, but COVID-19 certainly has been an extremely significant stressful event, which has made people have all kinds of reactions. Some of them are positive, some of them are quite negative, and some of them are still, we are still in the process of figuring out, what it does in terms of various psychiatric conditions, not just anxiety and depression, but its impact on as a traumatic event, its impact in terms of even conditions like bipolar disorders or schizophrenia, which are much more of a purely biological conditions in psychiatry. But still, COVID probably has an impact even in those conditions too. But here in this, I thought I'll just go down several steps to try and talk to you all about stress, anxiety, depression, the psychological adaptation all of us actually go through, and also talk about, in brief, about some primary prevention approaches to manage stress and trauma. So let's start with trying to understand what stress is. Stress is a normal reaction which tends to happen to all of us. It is there all around us. Stress can even be positive because, with stress, people, when they are stressed, they sometimes tend to perform better in, let's say, an examination situation or in an interview. It tends to motivate people to actually adapt and perform well. So it can be positive too. But with COVID, the stress has been a continuous kind of a stress, which has been going on for nearly 2 years. And that has been an issue because chronic stress, as we all know, tends to actually break down the body and the mind in several ways. And it tends to actually bring forth illnesses or disorders. Now, if you look at anxiety by definition is considered to be a state of dread, an unpleasant feeling that something bad may happen to us in the future. And depression is again a state of being flat in mood, low in energy, low in motivation. Now, anxiety and depression are, anxiety particularly is quite a normal reaction. It can happen to all of us. So having anxiety doesn't mean that you are actually abnormal or you are mentally ill. Similarly with depression too, a lot of people can have depression as a symptom. It doesn't mean that they are having an illness or a disorder. So that's something which we need to keep in mind. So it is okay for us to be anxious. It is okay for us to be a little depressed also. And it's also okay for us to be stressed. But the scenario of COVID is actually quite a complex one, because it's been such a prolonged kind of an impact, affecting all of us and affecting at various levels. For instance, lockdowns, disruption of our way of life, loneliness, social isolation, people dying of COVID, lots and lots of negative news flow from the media. We have to then make decisions. Should we get vaccinated? Should we not get vaccinated? Should our children get vaccinated? Should people with physical conditions get vaccinated? So you've got to make decisions. And these are all life and death kind of decisions. You know, we have to do all these things. And this is quite stressful. And hopefully in the years to come, maybe in 2022, we'll probably have a lot of freedom from COVID. And maybe after that, it'll be COVID would be like any other past pandemics. It will be past history. Now, it's important to try and understand that if you look at our body and our mind, if you look at us as an individual entity, so we are what we are because of our past experiences, good and bad experiences, life events, which are, sometimes could be positive, could be quite dramatically negative. Life events in the sense, if you change a job or move houses, get married, have children, or it could be negative life events where, you have deaths in the family, or, your parents died when you're young as a child, for instance. There could be negative life events or failure in exams. They're all life events. So all these experiences which we have tend to affect the way we perceive ourselves and also the future. And it also makes a difference to how we individually adapt to stress and cope with stress. And the Venn diagram in the center, mind and the body, they are interconnected. There's nothing called mind separate from the body. If the mind goes, the body goes. If the body goes, the mind goes. So it's like that. If the mind is healthy, the body is healthy. The body is healthy, the mind is healthy. So they crisscross. So if you look at the current situation and our perceptions of the future, the perceptions of the future are related to our past experiences, and that's to be kept in mind. So each person can cope with the same COVID situation in myriad different ways, in so many different ways. And it's also important to know stress generally, when there is chronic stress, it tends to actually increase the cortisol levels in the brain, and cortisol levels affect the body. And too much of cortisol secretion is not actually good, because it tends to actually make the body not adapt properly. Now, from a perception point of view, when we are, let's say, anxious, and when we become, we have an anxiety disorder, let's say, we tend to actually perceive the future in a different way. We may perceive that we don't have control over the future. We may perceive that the chances of us getting COVID-19 is very high. It's almost certain. Or some people may actually perceive that, oh, there's nothing to worry about. COVID is just a fallacy. We don't have to worry about anything. So perspectives can vary in various dimensions. Or some people could have a more balanced perspective. Let's make sure that we are careful. Let's be cautious. Let's take all the adequate precautions. The risks could vary of catching or contracting COVID or any other infection. So our perception of the future will define whether we become anxious about a situation or not. So this is an important paradigm to keep in mind, and it will actually define whether we actually suffer from mental health conditions as a result of this COVID pandemic or not. And the other thing to keep in mind is, in psychiatry or in mental illnesses, there is a concept called your own vulnerability and crossing a particular threshold to have a condition of a mental health disorder. Like I said, anxiety is a symptom. Anxiety doesn't mean that you're abnormal, but at some point of time in the future, if you cross the vulnerability threshold, then you have an anxiety disorder. A simple example is, let's talk about physical illnesses first. It'll make it easier for us to understand psychiatric conditions. So if a young man is there, he grows, a person grows into a young adult, a middle-aged adult, and then older, and becomes an older person, and then he reaches, let's say, 90 years or 100 years, and then he dies. Now, there could be a person who is a young adult. He starts becoming quite sedentary in his lifestyle. He starts smoking quite a bit. He starts using pan parag. He starts eating junk food almost virtually every other day. Let's say what happens by 30, he crosses a threshold where he starts getting cardiovascular problems. He starts getting hypertension. And by 40 or 50, he starts potentially getting very close to having a stroke or a heart attack. And if he survives beyond that, he may become more vulnerable to cancer of the mouth or the lungs, things like that. So you cross the vulnerability threshold much more faster. It depends on how you actually lead your life. Similarly, also in mental health, you start crossing the vulnerability threshold to have an anxiety disorder or a depressive illness, depending on how you adapt to stress and how you cope with stress. So that's an important paradigm for us to keep in mind, and that's the reason why it's important for all of us to start developing psychological adaptation and psychological coping, and also start thinking about primary prevention, psychological first aids, primary prevention, things like that. I was just looking at the prevalence of anxiety and depression in the general population. Before COVID, the prevalence of anxiety in the general population is as high as 20%. So they're all high prevalence conditions. Anxiety as a condition is about 20%, so 1 in 5. Depression is much more rarer, but it's about 6% of the population can be depressed, a little more in women compared to men. But during COVID, what we realized is the prevalence of anxiety and depression actually shot up by about 10 to 15%. And one of the other factors which they also picked up was insomnia, lack of sleep, which is a common denominator for stress, anxiety, depression, also went up to about 30%. And that can actually lead to a kind of a very negative feedback loop, and it can affect the the body, the mind. You are more vulnerable, and you cross the threshold to become anxious, to become depressed as a condition, as an illness. So I keep talking about psychological adaptation to each and every patient, just as this is as important as prescribing medications for a person with severe depression or a severe anxiety disorder. And adaptive techniques need not be very complicated. They can be quite simple. They could be things such as exercises, meditation, mindfulness, gardening, grounding techniques like having prayers or family meal times, having sit-down conversations with people around you. Groups like yourselves can also be quite important for psychological adaptation, because it offers grounding. It offers a sense of belonging. And that social network is so crucial to actually prevent depression, to prevent anxiety disorders, or prevent depressive disorders. There are a number of very simple apps which are now used by a lot of people. Like for some of my patients, I actually talk to many veterans who are all quite severely affected with PTSD. And one of the apps we talk about is an app, a self-hypnosis app called Reverie. And it tends to actually work very well for people to get into sleep, stay asleep, stay relaxed, etc. So these are all the things which can be used, but they must be used regularly. practice makes man perfect. The same way, if you practice these things regularly, make it a part of your life, your psychological adaptation improves, your vulnerability to become depressed or anxious or have a stress disorder becomes less. And when that happens, you actually become better, even physically. There is very clear evidence that people with cancer, if they are more positive in their self, if they are less prone for anxiety and depression, tend to actually live longer, even with the same kind of cancer treatments, compared to a person who is actually quite anxious, quite depressed, and doesn't have good coping strategies. So these are the things which can be used, should be kept in mind. One of the things which I also thought I should add is the concept of psychological first aid. Hashim was just talking to me when he called me up about this talk, and he said, a lot of people have died. A lot of people in India, relatives, they have died, and they call up and they actually wonder, what can we do? What can we do to help them? Or when they call up, what do we do? How do we respond to them, to such crisis and sudden traumatic events such as that? So the concept of psychological first aid is a very important concept in trauma psychiatry, where very simple things such as uh, comforting the person, consoling the person, sitting down with them, holding their hands, embracing them, providing immediate practical help to the people who are in grief or who are suffering or who have lost somebody who is very beloved to them, facilitating active listening, empathic listening, so that people can just talk about their problems or their trauma stories. All these things are what are called psychological first aid. So it's just like first aid in physical medicine, where you do a CPR or resuscitation. Similarly, also there's something called psychological first aid. This goes a long way in actually helping people cope, adapt, make them more resilient, make them less vulnerable to developing a future mental illness. So these are all some of the things which I thought I should say. Primary prevention. Primary prevention is a very important thing in psychiatry, just like in physical medicine. So I thought it's very important for us to just talk briefly about these things. So with this, I think I'll just leave it at this. I'm sure there'll be questions or comments. I'm quite happy to take them at the end of the sessions today. So I'll leave it at this. Thank you so much.
Thank you very much. Can you hear me? I'm not sure.
Yes. I can hear you.
Right. Okay. Yeah. Thank you, Prashant and Dr. Mayur, for giving the expert opinion there. Now, I would like to welcome Dr. Sunita to give her expertise and her opinion in regards to the her talk related to psychological resilience and adaptation to stress related to COVID. I welcome Dr. Sunita now. Thanks. Bye.
Thank you. Thank you, Prashant. You can hear me all right? All right.
Yes.
So thank you for inviting me. In the last 2 years that we've been working in mental health has been, I think, one of the most busiest and the hardest in terms of the workload, in terms of the clients and distress. And I was thinking about what would be interesting for people to benefit from what sort of the work that I have seen. So one of the first things is COVID seems to have made anything that was a problem worse. So if you've had anxiety has become worse. If you have had OCD, it has become worse. If you've had problems with your relationship, so it's almost like whatever was bothering you, but you could not focus on because you had other things on. Now you're stuck. You sort of have to face it, and sort of everything has escalated. So what that has meant is not just for that one person. The interesting thing about COVID is that everybody is going through this. So usually in a family, when we have somebody, it's one person who's struggling with a particular problem and other people are okay. In this particular thing, I'm as affected in a similar boat as my client. So there's like a global thing, and that means the family system, everybody is struggling to support each other, community is struggling. So that's been quite a remarkable thing. So Prashant's talked about the mental health aspect of it. I just wanted to go into the practical stuff of how do you know if you are not doing well? And the well could be that you're stressed to you're actually having a mental health issue. It could go on that increasing severity. And one of the things I often tell my patients is if it is most days, most of the time, that's when you are really thinking this is more concerning. I need to seek external help. So that's one simple way of thinking. Out of 7 days, if this is making your life a struggle, 5 out of 7 days, it's time to seek help. But if it's lesser than that, it's a couple of days, the periods that you go through, and you're able to seek support and get help with it within your immediate network, that is one good indicator of, okay, you can manage. So I think that's a quite a simple blanket rule. And I was also thinking, because you might have concerns about a family member, you might have concern about a child. It's also good to think about what is it that we are looking at. If you're saying everybody's going through stress, how do we know someone's not coping, right? So there are 3 broad things you can look at. So one would be just the mood aspect. Someone is more irritable, they're more angry, they look more sad, or they're more anxious. So these are all the mood factors we look at, which is, you might have a teenager who's more snappy, or they're not talking as much. So you can see definitely an emotional withdrawal. So that's one thing you can see. What you can also sometimes observe, either in yourself or in the other, is what I call the cognitive, the thinking aspects. So commonly people would say they're finding it hard to concentrate. They forget things, making decisions are hard. So it's almost like their thinking is cloudy. So they're not able to think clearly. So that's another good, and often that's seen, right? You might find that this person's forgetting things or not remembering, or they look distracted, are not able to focus on things. So that's another thing to check on. And thirdly, I would say behavior. So often restlessness, fidgetiness, they're increasingly eating more or eating less, sleeping more or sleeping less, or gaming more or disengaging more or withdrawn. So behaviorally, there are some changes that's happening. So these are what I would call ways of looking at thinking, okay, there might be something going on with this person and I need to, whether it's me or someone else I care about, there's something going on there. Excuse me. So who are the most vulnerable to be affected by this? So we are all affected, but who are most at risk are, of course, older people, people with comorbid health issues, people with disabilities who have other histories of previous histories of depression, and also people who have never been able to access social support outside. So these people are at higher risk to develop more problems, because they already have, I think Prashant talked about, your history, your previous past, you already have some vulnerability sitting, which makes you more at risk for coping. So our coping resources are not that good if you've had these experiences in the past. That make you, so if you think of it as a tree and it's not that strong, it is more likely to fall down when facing a storm. And people who are isolated, who are not supported, who have previous histories of mental health, physical illnesses, they could be more at risk to have these psychological issues. So I'm not going to discuss a lot of, because Prashant's covered a lot of the psychological or mental health aspect. I'm just going to talk about what helps, what has helped for a lot of clients. So I would start with the basic thing that you want to do, eating, exercise, looking after your well-being as almost like the foundation. That's the table on which you put everything in. So those 4 legs is that you are trying to have adequate hours of sleep. You are eating a balanced, healthy diet. You're able to have some level of social interaction, and you're also able to have some exercise and activity. That is, I think, the 4 almost legs of this table. And all of that is important. I mean, sleep is very important. And one of the things Prashant talked about it, one of the things I see a lot is sleep is a very big issue right now. So because a lot of kids don't have to get up and go to school, or you work from home, you can stay later in the day and do the work, so you sleep in. So having a routine and having a regular routine is very, very important. It creates almost a scaffolding to manage that, versus somebody who works till late, sleeps in, just doesn't change, gets into the pajamas, sit at the bed, work in the bed, sleep in the bed. So those kind of things are important. So having a routine is very, very important. Something happens to our brain when we have high level of stress. So stress means there is a pressure on us to adapt, right? So we either fight it or we have to fly from it. So we talk about the fight and flight response. When we are not able to do either of it, our brain starts to shut down. It goes into a state of collapse, which is what we call a depressed state, where I can't do anything. There is no point. I might as well give up. And when that happens, it's almost like the lights are shutting down in a system, and we sort of start to not engage as much. So anything that works opposite to that is very helpful. So which is why I think exercise and physical activity is almost moving you to the higher level of action, which is the fight and flight, and not shut down. And I think if you're in a higher level of, at least you're moving, you have some bit of hope of escaping, resolving this, versus not being able to. So I think those 2 aspects are very important. We also have to think about the emotions. So being able to acknowledge that you are struggling, being able to talk about that, whether that is to your family, maybe to your friends, being able to talk about the grief. A lot of people have lost family members, and grief is real. Grief has to be acknowledged. Grief has to be talked about. The problem is that a lot of things that we as a community would do for grief cannot be done because we are isolated. You don't visit each other's houses. You can't visit when somebody. So a lot of the natural grieving mechanisms that we've had have broken down. So it's really important that within the circles that we have, we are able to acknowledge it, talk about the grief, talk about the loss, so I think talking about feelings rather than not think about it, just be positive, is really unrealistic when there's a constant bombarding in the media and around about how bad things are, or how you're living a life where you're restricted. So to me, as a psychologist, if you say, don't think about it, you're being dismissive about it. But it's to say, yes, this is happening, this is real, but what can we do about this? And that, I think, is an important aspect to think about. And especially for children, I think it's important because they are expected, teenagers, young children, they're expected to do all the boring parts of the school and have no fun parts of the school. So no friends, no going out, all the things that keep them going are not there, but they're just supposed to study, do their assignments, and it's harder to focus when you've sat there for. So it's really important that you don't dismiss those aspects and encourage communication and talk to them about what's happening. And sometimes that might mean you role model that, saying that, I have struggled myself. this has been hard for me, and rather than be dismissive of that, I think that's really important. I also think there are lots of like there's so much value in spirituality, so mindfulness practices, relaxation practices. A lot of young people use apps for calming, prayer, community groups, talking to people in any kind of forum, whether it's support groups or specific needs. All of that is really helpful in being able to manage how you're feeling. I also would say that if all these things you don't have, that might be a time for you to ask your GP to seek external help. Because especially in Indian communities, I think we are very scared. We have a lot of shame about accessing support, mental health support. So you don't want anybody to know that, you don't want to take medication, you don't want to seek treatment because it's a shame. So you often try to hide it. And I would say that just like, you would take treatment, whether you have a infection, you have diabetes, your GP is the best person to go to. See your GP, and they'll be able to refer you to a mental health professional, someone who can help you with. I think that's pretty much it from me. If there's any questions, I'm happy to take it.
Thank you very much, Dr. Sunitha, for giving us your expert opinion. We welcome your expertise very much and appreciate your presence here as well. So, yep. There was somebody. No, okay. So let me continue. Yeah, so basically we have gone through the panel speakers now. There is nothing much to add there. They have covered a whole range of topics there, and they have given us a good idea about the strategies, what we can use to prevent our anxieties and stresses to becoming an issue in the future. Unfortunately, the uncertainties and the time we are going through is tough. So, but we have a role to play as a group to support each other. So that's all what I would like to stress in this, give my opinion in terms of adding a little bit there. I cannot stress the importance of supporting each other. And we have a big responsibility as a group to support all the members in this group in this tough times. And we have to expect that this tough time to last a little longer, even though things are getting better probably. So let's hope for the best. So I think that it's time to move on to the questions. We have few questions already, which has been submitted through the Google Forms. So I have those questions in front of me. I think any of the expert panel members, either Dr. Sunitha or Dr. Mayur, could answer those questions. Yeah, welcome to answer them. I will read them out, and gradually we can move through those questions. Is there anything else we should be doing before moving on to the questions?
No, you're fine. Question answers. Yep.
Okay, all right then. So we'll move on to the question answer sessions then. So the first question which came through the Google form. So first of all, before starting the question sessions, I would like to thank all the participants who have sent the questions through Google Forms or through other means for actively participating in the session. It's quite important that people do ask questions and rectify if they have the doubts they have and share the knowledge as well. So it's quite important of that. So people, if they have any further questions, the chat session is going on live at this moment in time. Please do submit those questions in the chat window, and we will read out those questions as it comes by. So the first question is from, I'm not sure about the person, but it's, I can now see that I am now easily getting angry at home, especially with kids. Why this sudden change, as I was not like that before? Is there any way to reduce it? Who would like to answer the question? Dr. Mayur or Dr. Sunitha? Well, any of you could answer that.
Or both of
Maybe.
you can answer.
Yeah.
Sure. Look, the first question to ask when you're getting easily angry at home, especially with kids, I think the first and the most important question to ask is, ask yourself, why are you getting angry? Then you'll have the answers yourself. So that will be one way of approaching this. Why are you getting angry at your kids at home these days? And each person's answer to that will define how we actually start solving the why question. So that'll be one way of looking at it in a very simple way.
Can I add something?
Yeah, please.
So I'm assuming this is a female asking this question. I don't know whether that's true, but I'm just going to assume that's the case because women end up stuck with children a lot, and we are in tight spaces. So one of the things that has happened with COVID is that the spaces we had as individuals, where children would go away to school or children would do things on their own, those things have stopped because now they're at home. So they are seeking us more. So there was a study done years ago which says a child about 4 or 5 comes to a parent 15 times with things that they ask. So, and you often, I think on an average, say 2 or 3 times only say yes. So 14 times almost you're saying no to the child. Can I watch TV? Can I have ice cream? Can I have a drink? So this, if you think about that, the number of encounters you're having with somebody and you're saying no to them, it is going to create some emotions in you. And here you have a place where you're under lockdown, you have children, they have no one else, they come seek that from you. So they are draining, asking for things that can be quite overwhelming. So what is anger? Anger is telling you someone is taking more than you can give. Anger is a valid emotion. It says it's too much. I can't give anymore. I need to shut down. It's not children's fault that's happening, but for you, it's indicating that this is getting too much. So it's common that when you feel that I can't give anymore, you can only then respond in anger. It's a way of protecting and saying, I can't deal with it. It's saying that it's not children's fault, they only have you. So you have to manage anger differently. So one of the things I would say is that if you're the only person and you have a partner or you have someone else, ask them to step in at times to help you with whatever is happening with the children. If you are taking this on voluntarily and you're the only one facing this, it's harder. So if you can seek support from the person available, I think that would be helpful. I also think there are ways of managing anger, taking some time out for yourself, going for a walk. When you feel angry, that you can say that your anger is, you don't have to act it out, you don't verbalize it, you don't say that to child, you go take some time for yourself, scream into a pillow if you need to, and come back. Have a shower, go out for a walk, sit outside for 10 minutes, anything that can help you as you become aware of the anger is building, rather than wait for an explosion to happen. But also being able to talk to children about, I might need some time, I'll come to you, wait, and teaching them that are some of the strategies that can happen. I also think if you've had a parent in your life, a father or mother, who've used anger as a way of shutting you down, sometimes when you are under pressure, you use that as a way of coping. It's a bit complex because that's the tool you've learned. That was what was used for you. So when under pressure, you use what you've learned. I don't know whether that's helpful, but that's for me.
Thank you very much. We'll move on to the next question. The next question is, any one simple tip to remain positive always? I have been struggling with my job and career during this pandemic.
cannot be positive always. That itself is unrealistic. You know, we when things are bad, you cannot necessarily be positive. What you can be is compassionate and kind to yourself. So being compassionate is something you can practice. If you can say, oh, everything is wonderful, you're not going to believe it. But to say that this is human, this is life, I am doing the best I can get through this. You know, I have coped with other things and I will survive this. I can manage this. This will end, are all compassionate ways of looking at things. There is an overemphasis on positivity, and I don't think that's helpful, because it's hard to achieve. It's not a state, you know, to constantly be striving for. But compassion, kindness, and you know, in Islam, that's something that you always talk about. Your connection to God and feeling, you know, calm and connected and hopeful that there's somebody looking after you. So I think that having a more compassionate, kinder viewpoint is achievable versus positive thing. Struggling with career, I don't know specifically what that means. This has been a hard thing for a lot of people. I guess being hopeful that when the pandemic ends, things will get better. I mean, I don't know, Prashant, do you want to add something?
Prashant is on mute.
You're mute.
So conversion of, let's say, negative thoughts into positive thoughts cannot happen automatically. You can't suddenly convert all the thoughts into positive thoughts. All you can try and do is trying to be as realistic as possible. Yes, I have a situation where I think I'm having problems with my career, with my stability of my career, financial issues. So the question is, yes, this is a reality. What can I do about it? How do I try and find solutions for this? And that'll actually lead to adaptation in a realistic way. And that'll actually be in the long term. It'll allow you to grow, because when people go through COVID, it's not that they're all going to be negative at the end of it. This is a significant, significantly stressful event, but there is a lot of recent research that COVID may actually result in personal growth in the person, in families, and also in the community. So if you try and find solutions within whatever you can, even if you have to change jobs or try and apply for new jobs, that itself will be quite an experience for yourself. And at the end of it, you will grow as a person, as a human being, and become more stronger and resilient. So it's not a bad thing actually to go through difficult patches in life.
Thanks, Dr. Mayur. So let's move on to the next question then. Is there any online psychological assessment tool that helps in understanding our mental health? So the question is about any online psychological assessment tool that helps in understanding our mental health.
Psychological tools. See, there are some screening tools which, let's say, general practitioners use, called GHQ, General Health Questionnaire, and that will allow us to actually detect whether somebody has a common psychiatric conditions like depression and anxiety. In perinatal psychiatry, also there are some screening tools which people use. But we don't rely these days on psychometric evaluations in our practice to try and see if that person requires mental health intervention. A lot of GPs use some scales which are very simple screening tools, like depression and anxiety screening questionnaire, DAS. And there are a lot of cutoff points which might indicate that the person needs further interventions and help. But we tend to actually sit down and try and do a clinical interview with the patient and then decide whether the person is actually in need of intervention, psychological or medication interventions and other kinds of interventions. So we don't rely on questionnaires, but it's a very anonymous way of actually seeking help, and that's a first step. Beyond Blue has, I think, some questionnaires, and they can be used, and they might actually tell you that, yes, there's something not right, you better go and get some help.
So Beyond Blue is the best website to go to in terms of if you want to do some screening for yourself.
Okay, great. I think the next question, I think it would be better answered by Dr. Shahir or a medical doctor. The question is, though the world has overcome many pandemic situations before, will it be the same for COVID as the emergence of new variants and the lack of foolproof vaccination worries us? What is your opinion?
Dr. Parapil, you want to take that question?
Yep, I can take that question. I think, yes. Look, I think first of all, let me contradict to the second line. There is definitely a full proof for that vaccination is very effective. If you take the ICU admitted data to the hospital, it always clearly says, of course, we get infected, but we are not seriously affecting, and we do the ICU admissions and the complications of COVID is very, very minimal in those patients who are fully vaccinated. That's the way to go, and you have to keep in mind that. So second thing is that, look, all the pandemic, if you look in the past, I've been well controlled with a well education. It's a combination of, treatment, education, and awareness. So I think if you go on that strategy, I'm pretty sure COVID can be, well controlled. I mean, I'm not saying it's going to disappear in 6 months or 7 months, but it definitely is going to be with us for a long time. And what we need to practice is the preventive measures that's going on. Example, hand washing, mask wearing in the public, and keep distancing. And we have to, my understanding is we may even come with a booster doses for the immunity against these viruses. So definitely it is going to be, contained, and that will be moving forward. And I'm sure things will get more brighter as we go from here now. I hope that answers the query.
Thank you very much. So we'll move on to the next question. Again, it's a general, it's not a, it's a more psychological question. I keep my phone always with me everywhere. I am feeling very much disconnected when my phone is not with me. Maybe
Sunita,
Dr.
Sunita, you want to answer the question, because it's so common, isn't it, these days? You must be dealing with it every day.
Recently, I saw a Malayalam movie saying that looking at the fridge and phone is a common thing nowadays for the youngsters.
Yeah.
I think if anything to add.
Sunita, your mic. You want to say something?
I know, I switched up. I have nothing really to say to that question.
Are you also affected by that?
Sorry?
Are you also affected by that?
I think so. I mean, because of the instant gratification of the phone, I think we all, I think, have a problem with that. I think the devices are addictive. So and also because right now it's a way of connecting. So I don't know. I have no answer to that. If it is a problem, you minimize the use. You keep it away, that, and see how you go with that. And I know that there is no real danger if you keep the phone away. So you work on that anxiety if you're keen to do that.
This is a very important question in our day-to-day discourses with our patients in the hospital and also in the clinic. You cannot take the phone with you to bed. You cannot have notifications after 8 o'clock, which is pinging into your phone. You need to have a time where you can actually look at your email maybe once or twice a day, or maybe maximum 3 or 4 times a day, rather than checking it every minute. Otherwise, you're not going to sleep properly in the night. You're not going to actually manage your stress levels, and you're going to have problems. In fact, a lot of people, if they don't sleep properly, they're really asking for trouble. They'll potentially get quite a serious mental illness, including hypomania and mania. If you don't sleep properly, you have problems, all kinds of problems. So not just mental health, you can also have a lot of physical issues too. So it's very important that you address the problem in ways where you're protecting yourself and you're actually providing yourself a lot of stress coping buffers. In fact, in our hospital, patients are not allowed to have phones with them. And some of the patients are admitted for 1 month, 6 weeks, 3 months in the hospital with all kinds of mental illnesses, all kinds of anxiety disorders, depressive illnesses. What happens after a couple of days? They struggle. They'll be demanding for phones. And after that, they become quiet. They don't need a phone. And we have phone groups maybe once a day where they actually check the emails, the smartphone, messaging and things like that. And they're okay with that. So it's possible actually. If patients with mental illness can actually adapt without phones, you and I can. Just a question of trying.
I think it's one of the measures what I advise my patient regarding insomnia. So when you go to bed, my first advice will be keep the mobile phones away from you.
Absolutely.
That's, it leads a lot of anxiety to them, but few people get adapted and they get a good sleep. I mean,
absolutely.
It's one of the most important thing which I stress on the sleep hygiene measurements I advise.
Absolutely. There's something called sleep conditioning. If you have a phone which is next to you or constantly beeping, you will never be able to sleep properly.
Yeah.
I'm just going to play a devil's advocate here. Can you imagine COVID without mobile phone?
Oh yeah,
of course.
1918
the pandemic, how we managed the pandemic? How would we would
1918
have
people managed 1918 pandemic without mobile phones.
How we can't imagine that without Zoom. So many Zooms we have had with family connection. There is no any disconnection at all.
I think we are hyper connected in this world. That's a problem.
Exactly.
Your brain is not rested. And if you really look at the brain properly now, the brain just doesn't have rest. And that's half the problem.
I think most of us are probably losing our deep sleep.
Okay, let's move forward.
Okay, let's move forward. So I think the next question again, either Dr. Parupal or Dr. Shahir could answer. Will the vaccination for COVID be a yearly requirement?
I might take that question, Alika.
Yeah, you can.
Dr. Mayur has mentioned about influenza pandemic 100 years ago, or more than 100 years ago. We are still vaccinating against it, and we live with the flu. We live with the virus. We don't even isolate too much. Now that we know about the benefit of isolation, because once we started isolating for the COVID, last year there were hardly any influenza infection. So will there be vaccine? Yes, if the virus is there, the virus is going to be one of our family member, whether it's a good family member or a bad family member, the time will tell. If it's a bad family member, we have to vaccinate. So it depends on the behavior of the vaccine, the virus itself and the mutation. If it becomes a harmless virus, we might stop doing the vaccination. If it is a harmful but not very fast spreading, then it might just got limited to vulnerable patients like old, sick, and also the health workers. Like for example, I can't work in a hospital if I don't get my flu jab. I don't think many of people who are attending this talk who are not medical will be having flu jabs every year. So this could be the case in the future. Thank you.
Just to add to that, look, now Australian government has already started immunizing the immunocompromised patients, and TAGI, the authorities of medical vaccination or authorities have not yet approved for vaccination for the adults. But in UK and America, they already started vaccinating the health workers. So you are right. I mean, in the sense, you may be having an annual vaccination for this, like just like a flu jab. But I don't take it my word, but that's the way we are going forward.
Sure. Great, thanks. So the next question is, my kids have got addicted to TV and gadgets. They are now asking for games in my phone. It seems like it is difficult to bring them out from this. Any suggestions?
So I have a couple of things to suggest here. So we already have a lot of data coming that games are quite addictive for children. And, in Japan and Korea, they have de-addiction centers for gaming because of this whole, loop that kids can get into. And I don't know whether, recently China has declared that parents cannot let children play on games more than 1 hour a week. So it's just come as a national rule. So there is some data coming out about how addictive online gaming and all of that is. So that we are looking at that as the worst case scenario. Of course, because we've had COVID and lockdown, and we have television and games have become babysitters for parents. So when you don't want children to be bothering you or you want them to be away, you offer this babysitter to them. And then children want that babysitter even more. So the two things I would say is that when when the lockdowns or it's over, we are sort of resuming back. Children are going to have other things, their friends, their normal resources, all the things that they had before coming back. So there is some replacement that's happening. What you want to do is reduce the time that they're allowed to do and gradually come to a point where you think this. So you have to decide how much is good. And you sort of, rather than just stopping once, but slowly, gradually reducing it and coming to a point of okay, this is what you will get every week. So clear rules about that, and you have to be, as a parent, be quite consistent with that. So the children know that if I nag, if I push, if I chuck tantrum,
Hello.
I will get what I want. Then they will ask for it. So you, as a parent, have to be quite consistent. You have to have a clear rules and you have to follow through. But you also have to know that if they've done that for the last 3 months, it's become a habit. And like any habit, they transition and can go back to before. You just need to do that gradually. I mean, that is what I would, especially because of what has happened to them, I would say, rather than a harsh, okay, that's it. It's better to just slowly withdraw it gradually and minimize it to where it fits for them and you're happy with, rather than just shut it down.
I think adding to what Sunita said, I think parents also need to reduce the screen time, and they should also show their children that they are interested in other activities too, other than checking the Facebook for 3 to 4 hours every day, for instance. Second is, you need to actually provide a substitute entertainment or substitute thing which is actually something which kids love doing. It could be play, it could be going for a walk with them, sitting down and having a meal and talking in the meal table. Some innovative strategies will need to be used. Playing board games with them, carom board, chess, putting them into different activities, badminton or cricket or whatever it is. There's no simple answer. It has to be a mix and match and try different things. It may work, it may not work. If something doesn't work, you have to try something else. And just like any other addictions, you got to start early. You can't leave children to be what they are for years together and suddenly make them change when the let's say selective exams are coming or HSC exams are coming. It won't work like that. It won't work like that. It has to be the earlier, the better.
Great, thanks. We have around 14 minutes left for the question and answer session. I hope that would this expert panel members would mind if we extend a few minutes to complete. I don't think we might be able to answer all of them, but if we could do as much as possible, please, that we would really appreciate. But I think that we should move on as quickly as possible. So the next question. Sometimes I have difficulty concentrating or focusing in reading or in prayers, feeling like I'm losing interest in activities that formerly brought enjoyment. Is it something to worry about? I think maybe, yeah.
Okay. Yes, if Sunita was saying just a moment ago that if this is let's say happening 4 out of 5 times in a week, in a month, if it's happening for more than 15-16 days in a month, majority of the time that is, and it also seems to be related to your feelings of being depressed and anxious. All these symptoms are particularly worse in the mornings, for instance. That may have its own implications. And you might need to start talking to your GP about it if that's the case. So yes, it might be a problem.
All right. So the next question, one of my relatives is taking things more negatively after he survived from COVID-19. How can we handle that? Maybe Dr. Sunita could answer this.
Your mic is mute.
Yeah. So I don't know what negatively actually means, whether the person's feeling hopeless or feeling everything is bad for them. The simple thing I would start with is to be able to listen to this person and see whether the person really needs to talk about how this has impacted on them. Sometimes we hearing someone's pain and distress and talking about that may itself help them to sort of process that and move on. If you've had COVID and you've been quite unwell, there might be some kind of trauma response to that. And talking about this can be quite healing. Talking about that to people you care about is quite healing. So that is the first thing. I'm assuming that this person has struggled with the illness, and that is what you mean by negative. But if that is not it, there's more to it than that. This person has lost hope, has become, I would assume that there might be secondary depression or something else, and they might need a little bit more help than what you can, and that can be done like very caringly, that I know this has impacted on you. You seem to be caught up in this. You're not able to, is there someone we can help you with? Can we get you to see someone? So it depends on that. And I'm assuming that, but the first thing would be, if it's your family member and they're struggling, maybe they just need to be heard and allowed to grieve and process that, what this has meant for them. Maybe they've lost something, maybe that's shaken their confidence and their self-belief, and you just need to listen to that.
Okay, great. Moving on, as there is nothing much to do, I have ended up eating a lot than normal. What is the best way out? Can it be considered as stress? Maybe Dr. Mayur probably could answer this.
Yes, it may be stress, or it could be the context. You're bored, you have so much of time in front of you, and there's so much of food in the fridge. So you eat, and you're sitting in the house and working. So like, for instance, I'm having, I think I've gained weight. I've been drinking tea between patients, having a nice lunch between patients. That was not possible when I was actually going to the office or to the hospital to work. So we have to be careful about ending up gaining a lot of weight. It may not be a stress reaction. It could be a normal reaction to circumstances. Everything need not be considered to be a illness. I don't think you can suddenly develop an eating disorder in the middle of COVID-19. Eating disorders are a specific beast on its own. And the only thing you have to consider is if you're eating a lot, is it related to depression or anxiety? And are you developing a kind of a depressive illness? And eating is a manifestation of a depressive illness. So for that, to answer that question, you'll also have a lot of other symptoms of depression and and a lot of symptoms of anxiety too. Like, you may not enjoy your food, or you may actually not be sleeping properly. You might be worried a lot. You might have low energy levels, low motivation levels, poor concentration. So if all of them come together, that means you have a disorder. Otherwise, it could be an isolated symptom. You don't have to worry about it. It'll pass. You just have to go to the gym and work out, and you'll be okay.
Thank you very much.
Manju,
Sorry.
just a
Yeah.
second. Thank you, all the speakers. Just wanted to ask if you have time for 3 or 4 questions. You don't have to stay here. We have Manzoor. You are happy to stay back?
Yeah, I'm happy to stay back. No worries.
And Dr. Prashant and Dr.
Yeah,
Jo,
all good.
if you have to go, you may
No,
please
no,
go.
that's
There's
all
only
right.
a few more questions there. Maybe we can have a chit chat also, if we can open up the mic and people can ask questions as well.
I think we're here by 9
Only
o'clock.
if you have time, yeah.
So here by 9 o'clock, we have to close it.
Yeah.
Make sure everything has been as planned. Like last time, we can send the questions back to them. So we have to keep as per the protocols, please.
Okay, great. So next question, Dr. Sunita could probably answer it. So it's related to the response earlier. So what is the long-term impact on children when we say no? May not be related to COVID, or should we say more yes and less no?
That's a very good question. I would say children can definitely take no. It's not psychologically damaging to say no, but it also depends on the context in which you're saying. So I think your relationship is the most important. So if you think of your relationship as a jar, and every time you say no, you're taking a coin out of the jar, and every time you say yes, every time you connect, every time you engage, every time you hug your child, every time you respond appropriately, it is a coin going in. What you want is the jar not to be empty. So if you have a lot of positive, that child will be able to take some of the no's that come with it. So it's not necessary that, because some bit of resilience means being able to tolerate no, not getting all your needs met is not necessarily bad. But if you have a solid relationship that becomes the foundation, you have things invested with the child, you have your time, you have spent things, children can definitely take no. But if you can avoid no, you can distract, you can go on to, especially with little kids, if you can just distract them, engage with them, something that is definitely better than hearing no. Especially for younger kids, showing them something else, let's go and do something else to avoid that. But definitely we all can take no. It depends on our relationship. So solid relationship is a foundation for that.
All right, great.
May I just add one thing, that is, when you say no or yes, please justify it. At least to bigger kids, why you're saying no, why you're saying yes.
Sure. Great. The next question, maybe Dr. Maya could answer. It's probably about stigma. I want my partner to get mental support, but my wife, including her family, are hesitant to get support.
Yeah, I think it's a very important question, and it's something which this is particularly so in our culture, in our subculture, where mental health has a lot of stigma attached to it. Some of the things which we can do to overcome this is talking to your, if you have your good relationship with your GP, you can talk to your GP at the outset, or maybe a psychologist could be a good place to start, where there's less stigma, and it's also considered, a safe, non-judgmental environment. So that could be a way forward. Or, we were talking earlier about online, screening tools, Beyond Blue, for instance. Those are the ways we can move forward before you actually, you can gently push the person to actually come for help. But see, the problem with mental illness is that many serious mental illnesses are so different to physical illnesses. People don't go for help when they're really, really unwell with psychiatric conditions. Severe depression, people don't come for help because they're just lying in the bed. They may be lying in the bed for years, maybe a couple of years before they come for help. Psychosis is another classic example where people are very hesitant to come because they think everything is fine with them. So that is a danger. And there are helplines, and if you are suspecting that the person is actually at a risk to suicide, or there's a risk to their life, or something not really right, then there are some helplines you can actually access. There are some 1-800 numbers where you can call up and you can try and start seeking help, because mental illnesses can be it's a different ball game actually compared to physical illnesses. It's very frustrating. It's very frustrating.
Can I just add with that, that most of the time there is such a big stigma and shame to seeking help, which is why often partners refusing to come. So you as a partner can talk to them about that. There is no shame in this, that this will help our relationship. It'll help our children or family. It'll make you feel better. That's one. The second thing is that nobody needs to know about this person seeking help except for you. If it's you and your husband, you and your wife, you don't need to tell any extended family. So this person does not have to disclose this. And that you're allowed to, because this is your privacy versus, what will people know? Nobody's going to know. So being able to say that this is something you can try by yourself, and then you can see whether this works. This is not a commitment. Go see. And maybe you go with your partner. So to support them, that I'll come with you, I'll help you with this, we can do this together. Because often it's the fear that's stopping them. It's the fear of being judged. And if you can gently guide them and you're going to support them, maybe it will be a bit easier for them to access help. Of course, I mean, it's one of the biggest problem, the shame that we feel about seeking mental health. It's like you're weak or something's wrong with you. So having that as a private thing that only you and your partner does, and we do it together, and I'll support you, you might have some success with that.
Okay. Thank you. I think we might have only one more question, time for one more question. This will be the last question. Probably Dr. Aliparikul or Dr. Shahid could answer this much better. Could you address manage anxiety of parents when face-to-face, when the school starts on 25th of October, even though all teachers are vaccinated and all schools are maintaining level 3?
It's my question to Sunitha, I believe.
Oh, is it? Oh, sorry about that.
So Ali was asking the psychological aspect of the
Psychological
anxiety.
aspect. Okay, all right, great. I thought
think
that
Ali
it was
should,
more of...
I think Ali should have the answers too.
The reason
Not
because the
all
reason
teachers are not vaccinated. There are lots of anti-vaxxers
I
in
know
teachers.
it's a mandatory now. I think the reason is because we got a community school, a Malayalam school.
Okay.
So we are worried about it now. So what can you? Yeah, it's a big issue.
I mean, I think parents, the anxiety of the danger, I think is because the escalation has been there. And I think it's going to take time for people to come back into normalcy and safety, because this danger alert is so high. It is going to take time. So people will trickle in. It is not going to be that everything is open. And I think we just have to be patient with people, because everybody's process is different. And some parents are really, who have had anxiety before, I think they're just really freaking out.
Okay, thank you, Sunitha.
Thank you. So I think I would like to invite Dr. Shafiq for vote of thanks. I think we'll have to finish the session very soon. Our time is up, actually. So I would like to invite Brother Shafiq for
I think we
thanks.
have only one more question, right?
Is it?
In the chat?
No,
Or
There's
is
a question in the chat box. Whether if we have time, you can answer. Otherwise, we can move on to the final conclusion. This question just come up now.
Okay, somebody read, and yeah, you can finish last question. Yeah, it's okay.
So I can read the question.
Yeah, please.
It's all about, it's a health professional. The questioner is a health professional. Is not disclosed his name. That's okay. That's fine. Already being a person with OCD, post-COVID, my OCD is terrible. I think you mentioned about it. It gets worse with COVID. I even took a break in job for the past 1 year and rejoined again a week back. But I constantly feel like I'm going sick. How can I get help?
Can I just quickly add, and maybe Prashant might contribute. As a psychologist, I think OCD, you need to seek help. You can't do this on your own. You most probably need a combination of medication and like CBT. It's a tricky condition to manage. Very hard to do that on your own. I would say you have to seek mental health support.
Absolutely. I think Sunita is absolutely right. And if OCD has gotten worse, COVID is a stress. With stress, all mental health illnesses actually tend to become more severe. And if that is the case, your current doses of medications may not be adequate. It might need to go up. And when it goes up, you'll have to potentially wait patiently for at least several weeks before you start noticing changes. And changes could be maybe on the order of about 10, 15, 20%, not a huge change. So you got to actually keep that in mind. And then the cognitive behavior therapy approaches, the exposure therapy, response prevention, the ERP. That is, you got to do things which you really fear. And you got to experience the anxiety, which will go up and up and up and up. And after a couple of hours, after an hour, the anxiety will extinguish itself and you will actually feel freedom from that OCD-based anxiety. And avoidance should not be there. You know, if the more you avoid, the more entrenched OCD gets. So it's very important that you overcome the avoidance. And it's a good thing you're back to work, which probably is a good sign that you're actually facing your fear, because you might be having fear of contamination, fear of germs, transmitting the germs to your loved ones. So that's where you need to start looking at the cognitive element of that, also cognitive therapy aspect of trying to actually minimize the tendency that you're really going to for sure spread the germs to everybody. So again, cognitive work, psychology, and maybe a psychologist like Sunita, who is more of an expert in OCD rather than a psychologist who is really inexperienced in terms of OCD and so on, might be quite useful.
Okay, thanks. Thank you very much. So that concludes our question and answer session. So I would like to now invite, first of all, I would like to thank the expert and panel members for answering all the questions kindly and taking your time to answer them. Now I would like to invite Brother Shafiq to provide us with the speech regarding more. Thanks, please.
Thank you, Dr. Manju. Good evening to all of you. Assalamu alaikum. On behalf of AMIA, I would like to propose a vote of thanks on this occasion. It was truly an enlightening session for all of us. First and foremost, I would like to express our sincere gratitude to both of our expert guest speakers, Dr. Prashad Mayur and Dr. Sunita Ajo, for accepting our invitation and sharing their knowledge with us on COVID and its mental impact. The session was really very informative and beneficial. The presentation was very crisp, simple, effective. And thanks for all your valuable inputs, advices. And I hope that the information covered will definitely help all of us to cope with change, deal with the uncertainty, and boost our resilience as we look forward to a future beyond COVID crisis. Thanks. And I would like to express my sincere gratitude to our program facilitator, Dr. Manju, and our program coordinator, Dr. Ali Parapil and Dr. Shahir Kaidan, for coordinating the session in an organized and effective way. And we have got a lot of questions, and the Q&A session we could answer some of the most important concerns and queries from our participants. And I would like to express my sincere thanks to AMIA, its committee members, volunteers for organizing such a productive session, which is a need of the hour. And a big thank you to all the participants who have been actively listening to this session and for all their concerns and queries. I hope the panel might have addressed all your concerns and queries, and this session will surely benefit us and make us strong. So once again, thank you all. Have a great weekend. Assalamu alaikum.
Thank you.
With that, Alika, we can't hear you. Your mic.
Thank you, everybody. Sunitha and Dr. Prashant.
Grace.
Oh, Sujay, I can't see him behind you.
No, he's not. He's downstairs with the kids. He's looking after the kids.
All right.
All right. See
Thank
you.
you all.
Bye-bye.
Thank you.
Thank you.
Bye-bye. Thank you all. Bye.
Thank you all.
Nisaka? Nisar.
Nisar പോയി.
പോയിട്ടില്ല നിസാർ ഇബ്രാഹിം.
നാസർക്ക. കൊറേ ടോക്കുകളിൽ എന്നെ ഒന്ന് ഇൻവൈറ്റ് ചെയ്തപ്പോ ഞാൻ തിരിച്ച് ഇൻവിറ്റേഷൻ കൊടുത്തത്, അങ്ങനെ വന്നതാ. ഏതോ ഒരു ഫോൺ ലോൺ ആക്കിയിട്ട് ഇപ്പുറം പോയിട്ടുണ്ടാവും. ദുബായിൽ എന്തോ ടോക്ക് നടക്കുന്നുണ്ട്.
അബ്ബാസ്ക, അസ്സലാമു അലൈക്കും. ഓക്കെ
അബ്ബാസ്ക ശബ്ദം കേൾക്കുന്നില്ല കേട്ടാ.
അത് മ്യൂട്ടിൽ അബ്ബാസ്ക.
അബ്ബാസ്ഖാന്റെ അൺമ്യൂട്ട് ചെയ്യണം, ശബ്ദം വരുന്നില്ല.
കൂട്ടി മ്യൂട്ടിലാക്കിയതാ.
മനുഷ്യരെ വട്ടുപിടിപ്പിക്കാനാ.
പിന്നെ പ്രോഗ്രാമേ വളരെ ഇൻഫോർമേറ്റീവ് ആയിരുന്നു, എഫക്റ്റീവ് ആയിരുന്നു. പിന്നെ ഐ തിങ്ക് ആൾക്കാർക്ക് പല ഡൗട്ടും ഉണ്ടാവും ഈ സമയത്ത്, പക്ഷേ മോസ്റ്റ് ഓഫ് ദോസ് മേജർ വൺസ് ആർ ആൻസേർഡ്.
അതിന്റെ വീഡിയോ ഉണ്ടെങ്കിലേ അത് എഡിറ്റ് ചെയ്തിട്ട്
ചെയ്യാം.
അല്ല, നമ്മള് പിന്നെ ഈ എപ്പോഴും ഉപയോഗിക്കുന്ന സാധനമാണല്ലോ ഫോണ്. ഷോപ്പിങ്ങിന് പോകുമ്പോഴും അവിടെ പോകും എവിടെ പോകും, ആ ഫോണ് ക്ലീൻ ചെയ്തതിനെ പറ്റി ആരും ഒന്നും പറഞ്ഞില്ലല്ലോ, അത് ചോദിച്ചില്ല.
നമുക്ക്
ആൽക്കഹോൾ വൈപ്സ് ഇട്ട് ക്ലീൻ ചെയ്താൽ മതി.
എന്ത് അല്ലേ, it is we touch it all the